Pelvic Floor Imaging Unit and Research Lab. This presentation is surely under supervision of Dr. Rania Farouk. So, male pelvic floor is indeed uncommon. How often we encounter males having pelvic floor dysfunction? According to previous literature, we found that only 5 to 15% male suffer from pelvic floor dysfunction in comparison to 25 to 50 in females, and that's a huge difference. About the literature talking about male pelvic floor specifically and only about male pelvic floor, there were few publications or papers talking about male pelvic floor only. So it's time to unveil the truth about male pelvic floor. As Dr. Rania said, it's an iceberg. We only see the superficial part of the tip of the iceberg. We don't know anything about what lies beneath. So regarding the disease prevalence in males, what kind of problems or diseases that male pelvic floor encounter? We found that males have higher incidence of perianal fistulae, and thus they go for a surgical correction as they end by having obstructed defecation syndrome. They have overactive bladder, lower urinary tract symptoms, and chronic pelvic pain syndrome. In comparison to female, which have the stress urinary incontinence at the top of the list, followed by pelvic organ prolapse as uterine descent and uterine prolapse. So we have a very well-established literature discussing female pelvic floor and pelvic floor dysfunction in female. We want to rely on this, to depend on this, to discover male pelvic floor. So let's explore some basic, and I repeat, basic information about male pelvic floor. How to approach at the beginning. We know that female pelvic floor is approached by the multi-layer system approach mentioned before by Dr. Rania. How to approach male. So in males, it's pretty simple. We have anterior genital triangle and posterior anorectal triangle, and that's it. We won't go through the composition or details about each triangle. This is beyond the scope of this lecture. So what about the perineum, as if we are looking at the pelvic floor from below? Is there a difference between females and males? So here's the diagram of the perineum in female, and here's the corresponding MRI image, axial MRI image. And here is a diagram of male perineum as well, and the corresponding MRI image. We can see that we have the same muscles as the ischial cavernosus, pulpospongiosus, but we differ in some areas. As males have the bulb of the penis, in comparison, we have the bulb of the vestibule in female. The muscular part, like puborectalis and other pelvic floor muscles and anal sphincter components are the same. So about the fascia, we had very interesting findings in male that the fascia of male pelvic floor had smooth muscle within, and that explains why the fascia in males are far more strong than females. But before going through the fascia in male, I want to remind you how endopelvic fascial defect in females appear on MRI. We know the saddleback sign, which is the bowing or the drooping of the posterior wall of the bladder if the patient has endopelvic fascial defect. So do men have the same pathology detected on MRI? We found that they do. In our cases, we detected endopelvic fascial defect or Denon-Villiers fascial defect in men appears at the saddleback sign as females. So cystocele. We often see cystocele in females, and it's pretty common. But there is no literature describing cystocele in males. In our cases, we did find cystocele, it exists. And here the picture, I plotted the PCL ممكن أشاور. I plotted the BCL in green, and the bladder descent below the BCL is measured as 1.5 centimeters. So the prostate. In females, we have, shukran. In female, we have the uterus, and it's often detected on MRI as a uterine descent or uterine prolapse. But what about prostate in males? We found also that it descends. Here is a picture of a descent of the prostate. We can see that the PCL is plotted in green, and we can see the prostate descending below the PCL, and part of the seminal vesicle is descent as well, has descent as well. So do men have male-specific problems in the pelvic floor? Yes, they do. One of the top problems that males encounter in pelvic floor is post-prostatectomy problems as stress urinary incontinence. Males often complain of stress urinary incompetence after their prostate being surgically removed. It depends on the pre-operative length of their membranous urethra. If they have long membranous urethra pre-operatively, they less commonly will encounter incontinence post-operatively. So in pelvic floor or in difficography, we measure two extra angles in males that we do not in females. They are the pupoprostatic angle and the prostatourethral angle. The pupoprostatic angle, normally it increases during micturition, and it is not expected to increase during Valsalva. The prostatourethral angle, it is reported that it decreases, it increases in case of benign prostatic hyperplasia. And this is how we measure both angles on MR difficography. So male often have global pelvic floor weakness or global pelvic floor muscle weakness as in females. There are some pictures explaining that males have anorectal junction descent, prostate descent, and sagging of the levator plate, as Dr. Rania said, most posteriorly, the muscle that is attached to the coccyx. So they suffer from global pelvic floor muscle weakness or descending perineum. Regarding obstructed defecation syndrome in males, it's more prevalent in males than females. We see it more often in males. And here are a few pictures explaining the obstructed defecation syndrome. The one on the right of the slide explaining that the patient had بس هو مش بيوصل أنا حاسة إنه هو بعيد أوي. A thickened puborectalis, and what we call that it's indenting the posterior aspect of the rectum, obstructing the defecation, and the one of the right has failed to defecate because of the spastic anal canal. So at the end, it's pretty short presentation about male. At the end, as we said, it's a tip of an iceberg. We know not so much about male pelvic floor. However, the unseen underneath burden reminds us how much we need to discover and to study in male pelvic floor. Thank you. Shukran.